A brand new study found that elite male athletes, men in peak physical condition, are leaking urine during competitions at 8 times the rate of average men. And 58 to 75% of them had no idea what was going on and why it was happening. I'm Dr. Rena Malik, urologist and pelvic surgeon. And today we're talking about what happens to men's body when they train hard and how this leads to leakage. First off, what is your pelvic floor? It's a group of muscles that sits at the base of the pelvis, and it controls 3 things that men care very much about. It controls your bladder, your bowel, and your erections. Think of it like the foundation of a house. Every time you run, jump, lift, sprint, pressure actually builds up inside the abdomen, and your pelvic floor has to absorb all that force. And it's doing this all the time. Basically hundreds of invisible reps during every single workout. And when those muscles are working well, you really don't even need to think about it. It's just working in the background. But when those muscles start getting weak or fatigued, or on the other hand, they become too tight and non-relaxing, like they're too tense, you can develop serious issues. Now, where does training fit into all of this? So a team of researchers just published a massive scoping review. They essentially combed through over 6,000 studies to find out the answer to one question: what is actually happening to male athletes' pelvic floors? And they found essentially 10 solid studies that answered that question. Now, as a baseline, men who are the same age as athletes, 20 to 39, in the general population, urinary leakage, or accidentally leaking urine, affects only about 2 to 2.4% of men, which is it should be 0, but it's still pretty low. The researchers found that in elite male track and field athletes, the rates jumped to 17.7% in one study and 18.8% in another. That's 8 times higher than the average. And up to nearly 40% of athletes said this happened during training or competition, like the worst time for it to happen. Even in weightlifters, which is lower impact than running, the rate was still 9.3%. That's 4 times the general population. And it gets more interesting. One study looked at what's called anorectal symptoms, which could include the accidental loss of gas or stool during exercise. And the rate of that was 61.8%. That's really high, over half. Now, the researchers wanted to know, is there a direct link between how much you train or how hard you train and how likely you are to have these problems? Or is it just that it's higher overall? Now, they standardized exercise across all the studies using something called MET, M-E-T, or minutes per week of exercise, and how intense that exercise was. So they looked at intensity and volume of training. And in research, when we try to see if there's a signal, we look for something called a correlation coefficient. A perfect link is 1, meaning that like this is every time you go up, it goes up by the same amount. This study found a link of 0.87, which is incredibly high. This means that the more intensely and more frequently you train, the higher risk of urinary symptoms or leakage. How does that work? Bladder control depends at least partially on those pelvic floor muscles, specifically the fast twitch pelvic floor fibers, which contract rapidly to handle pressure spikes during impact. These local fibers can actually get tired. They can't keep up with all the demand, and when they do, you start leaking. There's also evidence that overtrained pelvic floors, or when you have a high-toned pelvic floor, you get essentially an increased resting tension, meaning the muscle is always partially contracted and never fully recovers. That sounds like it's strong, but it actually impairs function and coordination. So normally when you have a muscle, it needs to be able to go through its full range of motion, right? It needs to be able to squeeze, contract, and then relax. But if it's partially stuck all the way, you can't go through its full range of motion. And when that happens, it can become a source of chronic pelvic pain. And in some cases, it can even cause issues with premature ejaculation or issues with erections. Now, here's the bigger issue. Between 58 to 75% of male athletes in these studies had no idea that their pelvic floor even existed. Now think about this for a second. These are dedicated, disciplined athletes who track everything: macros, sleep, VO2 max, recovery. But yet they've never been taught about a muscle group that is a huge part of their overall function. That's a problem. Now, it's not their fault. It's actually a failure of education, right? And what people are learning in sports medicine. Coaches aren't screening for this, trainers aren't asking, and they're not taught thought to. And in the studies, they noticed that screening rates for pelvic floor symptoms in male athletes are extremely low, and partially because a lot of people think that men aren't at risk for these issues, and partly because the conversation has never been normalized, right? Guys don't talk about these issues. And so they generally just end up normalizing these symptoms, and they're not getting the help they need. So what do you need to know? First, if you are leaking during exercise, even occasionally, that's not normal. It's not something you have to push through or live with. It can be fixed. Second, get a proper assessment, either by a urologist who is an expert in pelvic floor or a pelvic floor physical therapist who works with men that can evaluate whether your muscles are weak, fatigued, or too tense, or hypertonic is the term. And the treatment actually looks completely different based on what's going on with your pelvic floor, and you might not be able to tell completely based on what your symptoms are. More Kegels, which is what a lot of people think they have to do, is sometimes exactly the wrong answer and will make things worse. Third, think about your training load. Now, the studies show a dose-dependent relationship. That doesn't mean that you should train less. It just means that you need to be intentional about periodization and recovery. Your pelvic floor needs recovery just like every other muscle group that you take seriously. In my upcoming book, The Hard Truth, I actually outline a full pelvic floor relaxation and strengthening exercise regimen to help ensure that you keep your pelvic floor healthy and functioning. You can check it out at renamalikmd.com/hardtruth to pre-order your copy. Fourth, if you're a coach or trainer, start asking the right questions. Are you ever experiencing leaking during training? Is there any pelvic pressure or pain? Are you having any sexual problems that are new? Normalize it just the way you'd normalize asking about knee pain or shoulder tightness. It is just another symptom that we need to take seriously. And really, there should be routine screening protocols in athletic settings. Now, we're not there yet, but we can absolutely start the conversation now. Now, of course, there's some limitations to this research. All 10 studies that they included were observational, meaning that they found patterns, not necessarily cause and effect. So there's a correlation between training volume and urinary symptoms. Are they causing it? We don't know with any degree of certainty at this time. But physiologically, it makes sense. And the studies were not looking at the exact same thing. They measured exercise differently. They used different outcomes, which are really important when you're designing studies, and they looked at different populations. And critically, they really didn't look at multiple pelvic floor symptoms at one time. They really just siloed them into urinary symptoms, sexual function, pelvic pain. And to be honest, if you have a problem with your pelvic floor, you're likely going to have issues in multiple different areas, or you're going to be at risk for issues in other areas. Bottom line, what I want you to take away is if you train hard, your pelvic floor matters. It's a real muscle group. It can be overtrained and it can get fatigued. And the consequences can be real. If you are experiencing symptoms, talk to your doctor. If you're a coach, start asking. If you want to read the study in more detail, I always link studies in the description, and subscribe if you're enjoying this content, because you're going to get more science each and every week that will help you understand your bodies better. And as always, remember to take care of yourself because you're worth it.